Hi, nice to see you again. I am Dr. Changzi the Orange. In our last video, we discussed the diagnosis and self-assessment of depression disorders. In this video, we'll focus on the treatments. Is it difficult to cure depression? The answer is both yes and no. Depression can be treated through psychotherapy, antidepressants, a combination of both. When none of these work, individuals may even be treated with electroshock therapy or AI tools. However, most treatments are more effective for patients with mild to moderate symptoms and are less successful for those with severe conditions. Even when patients experience significant improvement, they may relapse or worsen during future challenges. This is why many experts view depression as difficult to treat. Well, it's important to remember that many other diseases are also difficult to cure. For example, cancer and diabetes often require ongoing management rather than a definitive solution. Think about how many times you've struggled to lose weight only to regain it later. Or how often old sports injuries resurface before fully recovering, with new setbacks emerging before the old ones are completely healed. It's a similar situation with the treatment of depressive disorders. The main treatment strategies for depression disorders are psychological therapy and antidepressants. We'll talk about psychological therapy first. Psychological therapy, also known as talk therapy or psychotherapy, is a treatment approach for mental health issues that involves speaking with a psychologist, psychiatrist, or other mental health professional. Many forms of psychological therapy focus on training the mind to respond to negative or stressful situations in healthier and more balanced ways. Similar to strengthening muscles after a sports injury, psychological therapy helps patients build mental health muscles by practicing new skills and habits over time. Patients are encouraged to rethink automatic negative thoughts, manage emotions, and develop healthier coping mechanisms. Guided by a professional mental coach, patients set gradual, achievable goals and work step by step to improve their mental muscle strength, endurance, and flexibility, while using proper techniques to avoid mental muscle re-injuries. There are 6 main types of psychological therapies: cognitive behavioral therapy, behavioral activation, problem-solving therapy, interpersonal therapy, psychodynamic therapy, and mindfulness-based therapy. Each is suitable to different types or severity of depression disorders. 1. Cognitive behavioral therapy, or CBT, is a form of talk therapy that helps people understand how their thoughts, feelings, and behaviors are interconnected. It's designed to help people change negative thinking patterns that may lead to unhelpful behaviors or distressing emotions. In situations where people feel stuck in cycles of worry, sadness, or self-doubt, CBT offers tools to break free by focusing on practical changes. CBT can be especially helpful for managing issues like anxiety, depression, stress, and certain phobias. The CBT consistently performs better than usual care. The effects are moderate to strong, but may not lead to complete symptom resolution for everyone. It can be carried out in one-to-one or in groups, which can be finished in 6 and 16 sessions. In the famous Pixar movie Inside Out 2, 2024, many elements of cognitive behavioral therapy, CBT, are present, even though no psychologist is directly involved in the plot. During puberty, Riley faces challenges such as striving too ambitiously for success and navigating the complexities of forming new friendships while maintaining old ones. These struggles leave her feeling over-anxious, leading to episodes of panic, self-doubt, and poor performance in her games. However, by addressing her negative thoughts, Riley learns to let go of the overwhelming pressure to succeed and instead rediscover the simple joy of playing. As a result, she matures emotionally, and both friendships and success follow naturally. 2. Behavioral activation, BA. Behavioral activation is a therapy technique that focuses on helping individuals engage in activities that bring them a sense of accomplishment or pleasure. The goal is to break cycles of avoidance or inactivity, which often contribute to feelings of depression, low motivation, or anxiety. The depressive individual may initially feel unmotivated, but therapist helps the person create a schedule of small, manageable tasks, encouraging them to follow through. By consistently practicing these activities, individuals can regain a sense of control and satisfaction in their daily lives. In average, behavioral activation works more effective than cognitive behavioral therapy. It can be carried out in one-to-one or in groups, which can be finished in 6 and 16 sessions. The acclaimed movie Silver Linings Playbook 2012 provides an excellent example of behavioral activation (BA) therapy. The story follows Pat Solitano, who has recently been released from a mental health facility after being treated for bipolar disorder. Despite his release, Pat continues to struggle with violent outbursts because he refuses to take his prescribed medication. Tiffany Maxwell, a widow dealing with her own undiagnosed mental health challenges, convinces Pat to train with her for an upcoming dance competition. She promises to help him rebuild his relationship with his ex-wife as a reward for his participation. Initially hesitant, Pat eventually agrees, motivated by Tiffany's promise. The external goal of the dance competition proves so rewarding that it shifts Pat's focus away from his unhealthy, impractical thoughts and toward a more positive and active lifestyle. Through this journey, Pat rediscovers his self-worth, strengthens his relationship with his parents, and takes a significant step forward by letting go of his unhealthy attachment to his ex-wife and beginning a romantic relationship with Tiffany. 3. Problem-solving therapy, PST, is a structured therapeutic approach that helps people to tackle everyday issues effectively rather than feeling overwhelmed or helpless. The process typically involves identifying specific problems, brainstorming possible solutions, evaluating the pros and cons of each option, and choosing a practical solution to implement. By practicing these skills, individuals learn how to approach challenges systematically, making it easier to handle similar situations independently in the future. The problem-solving therapy works well with depression and anxiety and is particularly effective for older adults. It can be carried out in one-to-one or in groups, which can be finished in 16 sessions. It is a little difficult to find a movie depicting main characters undergo problem-solving therapies under mental disorders. However, some movies contain strong problem-solving therapies elements. In Castaway 2000, Chuck Noland was stranded on a deserted island. He has to use problem-solving techniques to tackle each challenge, like building shelter, finding food, and making fire to survive. Although Chuck is a healthy, strong-minded person, the practice strategy is the same for a person with mental disorders. Break down your problems and develop step-by-step approaches. 4. Interpersonal therapy, IPT. It is a time-limited approach to treat mood disorders and to improve social functions. The target is to enhance a person's relationships with family, friends, or colleagues. The session may last 16 weeks. During therapy sessions, individuals learn skills to address interpersonal challenges, such as improving communication, setting boundaries, and developing healthier ways of relating to others. It is very useful in unsolved grief, social isolation, and difficult transitions such as menopause, retirement, and divorce. In the acclaimed movie Hope Springs, 2012, typical interpersonal therapy was addressed. The empty nester couple Kay and Arnold Soames find their marriage stagnant, devoid of passion and intimacy, despite remaining physically loyal to one another. Determined to reignite their relationship, Kay insists they attend an intensive couples therapy retreat, despite Arnold's strong resistance. The psychiatrist challenges them with increasingly candid questions about their sex life and emotions, encouraging them to express their affection and vulnerability while uncovering the reasons behind the loss of romance in their marriage. Under the psychiatrist's guidance, Kay and Arnold gradually learn to rebuild their intimacy. Though they face moments of embarrassment and even near disaster at the brink of a permanent breakup, the reserved and old-fashioned Arnold makes a decisive gesture, ultimately rekindling the romance in their lives. 5. Psychodynamic therapy. It is an in-depth form of talk therapy based on the theories developed by Sigmund Freud. It focuses on exploring unconscious thoughts, feelings, and past experiences to understand why behind your feelings and how you're drawn to certain situations. The therapist helps patients examine unresolved conflicts and significant events from their past, addressing issues at their root. You may think that the past can't be undone. What happened has already happened. However, psychodynamic therapy isn't about erasing the past, but transforming how it influences you in the present. Through this process, your therapist will help you gain awareness and understanding of your past, so you will no longer be sagging inside shame, guilt, and avoidance, but bravely start rewriting your story, beginning in the here and now. The 1991 classic movie, The Silence of the Lambs, vividly illustrates the exploration of unconscious thoughts behind a person's behavior. Clarice Starling, a young FBI trainee, carries a deep sense of guilt from her childhood, stemming from her failure to save a lamb from slaughter at the age of 10. This guilt becomes a subconscious driving force in her mission to rescue other silent lambs in the world. While this portrayal is not directly linked to therapy, it offers a glimpse into the principles of psychoanalysis. In another acclaimed film, Good Will Hunting, 1997, psychodynamic therapy was well depicted. Therapist Dr. Sean Maguire helps Will, a troubled genius, uncover the root of his deep-seated insecurities and self-destructive behaviors, his childhood abuse. Although Will cannot change his past, he learns to confront his trauma and, for the first time in his life, takes control of his destiny, choosing love and personal fulfillment over purely professional ambition. Psychodynamic therapy might be the most favorite topic of movie makers. Its efficacy is comparable to other cognitive psychotherapies and can significantly help patients suffering from common mental disorders, including depression, anxiety disorders, eating disorders, and personality disorders. However, as a therapeutic strategy, it takes quite a long process, taking 20-50 individual sessions. 6. Mindfulness-based therapy. This is the only cognitive therapy that is not focused on talking. Instead, patients will learn to use mindfulness practices like present moment awareness, meditation, and breathing exercises with the assistance of the therapist. Through those practices, the patients can break away from negative thoughts before those thoughts drag the patients into mood disorders and restore calmness, compassion, and a positive attitude. Mindfulness-based therapy is very helpful for major depressive disorder, anxiety, bipolar disorder, addictions, and also help the patients to improve their general physical health conditions. It is normally carried out in groups and requires about 8 sessions. Many movies feature scenes of mindfulness practice, but one of the most notable examples is Dr. Strange, 2016. Dr. Stephen Strange, once a brilliant neurosurgeon, finds his career shattered after a devastating car accident leaves him with severe nerve damage in his hands. When conventional medicine fails him, meditation becomes a crucial tool for managing his stress and regaining a sense of balance. Beyond helping him cope with physical and emotional challenges, meditation enables him to tap into mystical energies, ultimately transforming him into a powerful sorcerer, though of course this is not a typical outcome for patients dealing with depression. We are coming to the end of this video. In our next session, we'll continue to discuss the treatment of depression, focusing on antidepressants, electroconvulsive therapy, and AI tools. Thank you for watching. See you soon.